vaccine eligibility to an estimated 1.1 million Missourians.
The state said it received more from the federal government and that vaccine allotment will rapidly increase starting in April.
And as coronavirus vaccine distribution continues across Missouri, we are working to find out what you need to know about the rollout process.
We're taking the next half hour to speak with local health officials to help walk us through this vaccination process. Tonight, we'll be covering the new major vaccination rollout plan and who qualifies under this upcoming phase, and also ask about Tier 3 in the weeks leading up and the gradual return to normalcy we're seeing as some health guidelines start to be relaxed.
Tonight, we are joined by Dr. Randall Williams with the State Health Department and Missouri Education Commissioner Margie Van Dieven. And Dr. Williams, we're going to go ahead and start with you tonight.
Now, Dr. Williams, we did talk a little bit about who's all included in Phase 2, starting on March 29th here. That's just in about a week and a half. How many more Missourians are now going to be eligible under this new phase, Phase 2 specifically?
Yeah, thank you, Lucas. Thanks for having me on the show. About 800,000 are in Phase 2. And then when we move to Phase 3, that's about 1.1 million Missourians.
Okay, and Dr. Williams, what decisions went into play in order for Missouri to be able to move into that next phase, Phase 2, in the coming weeks?
Deborah, thank you. That is a great question. You know, as the governor said, we've had a plan incredibly well thought out in October. And I think last time we had talked about maybe moving possibly into Phase 3 in the beginning of May. But you might have heard President Biden today at a press conference. And it's just been very much driven by the amount of vaccine we're getting. We're going to very significantly get a very predictable amount of weekly vaccine, all 3 vaccines, starting on April 1st. And so that's really what's driven this, is we will have enough vaccine to move on into our next phases.
Dr. Williams, can you be any more specific as far as the amount of vaccine that the state is going to be getting? Right now, MU Healthcare, for example, had previously gotten about 4,000 doses as part of its allotment. How much more is each region going to see based on what you're hearing from the federal government?
Well, Lucas, again, it's a good question. You know, there's a state allocation which we think will more than double, at least weekly, of the 3 vaccines. And then you've also got to understand, as the governor said in the press conference today, there are all these other platforms that come through the federal government, whether it be Walmart or Health Mart or retail pharmacies or FQHCs or FEMA. So on parallel tracks, the state is getting more that we will distribute through regions. We also have to look at, you know, what the federal government is pushing out through their platforms. And so I think the message the governor and I are trying to impart to our more than 900 vaccinators and to the people of Missouri is, you really need to be ready to get vaccinated in April. You need to be figuring out where that's going to be, and vaccinators are going to need to be figuring out how they're going to roll that out, because it's going to be here very quickly.
Sure, and Commissioner Van Dieven, this question is for you. We want to know really how this announcement is going to impact Missouri schools, and really what way will Phase 2 affect your advice that you're going to be giving to school districts moving forward?
Yeah, so I think for us, the biggest change was the opening for to allow teachers on Monday. That was a big move for us, and we're really grateful, and we were happy to see that part of the plan come to fruition. How this next announcement makes a difference is in thinking about a number of our families who are working hard to have the confidence to send their children back to school and welcoming them back into their homes. So we couldn't be happier about the announcement from today and about the announcement that started on Monday. How will that change what's happening in our classrooms? How we're approaching this is one more mitigation strategy, and a very important mitigation strategy for our teachers. And we're so grateful to each of them who are taking that next step and receiving that vaccine. But we also are saying, we need to continue to wear our masks and social distance and wash hands and do everything, the cohorting, whatever strategies we have in place. because it's as important it has been for us to make sure schools were open. We want to make sure they stay open in a very healthy and secure way for our students and our teachers.
Let me ask you about the current tier that opened up for teachers and school staff starting on Monday, Tier 3, what we're in right now. Do you have a sense on how many more teachers and staff members at school districts have received their vaccine compared to those who were eligible maybe in previous tiers? Do you know where that's been across the state?
I don't know. I don't know that answer. I know a number of teachers certainly had other either age or health issues that they certainly wouldn't disclose to us. So that is something that is of each individual. But I will tell you this, that we did a survey early on a couple weeks ago to get a sense of how many teachers had provided answers in a survey that they were very interested in receiving the survey, and got great response, great turnout. We're asking our teachers to talk about the importance of receiving that vaccine and spreading that across the community. So I think we've had great turnout, but I can't give you the exact numbers yet.
Sure. And Commissioner, as far as the conditions that have to be met in order for all Missouri public schools to return to the classrooms, how do you think this new rollout of this next phase 2 could impact that decision for all schools across the state to be able to go back in person?
Yeah, well, I'm so proud of our Missouri schools. I just have to say, I think if you saw the report that came out last week, we were one of the top 5 states offering in-person learning right now. And so they've been working really hard to do that. Some of our schools have been open since the early fall, and just really pleased. So this vaccination has certainly been an important step for us. I think it gives our teachers in particular great confidence that they've been seeking. But I have to reiterate that it is just one of many, many mitigation strategies. And what we've been studying and learning more about is that when those mitigation strategies are in place, we just haven't seen our schools being places of the virus spread. So people are doing some great work out there, great jobs, and hats off to our educators for doing so.
All right. Thank you both, Dr. Williams and Commissioner Van Dieven. Don't go anywhere. We're going to continue our discussion on this expansion, both into Tier 3 this week and going to Phase 2 later this month. That's coming up next. Welcome back. If you're just joining us, we're taking this half hour to speak with state officials on the progress of the statewide vaccination rollout and what we can expect as Phase 1B Tier 3 begins to expand its reach.
Let's turn our discussion now to how the current tier is progressing. And Dr. Randall Williams, you were just talking to us literally seconds ago about a mass vaccination event that's happening in Cole County. Tell our viewers a little bit more about that.
Breaking news right here with Lucas and Deborah. I just got off the phone with Christy Campbell, and they're doing a mass vaccination event tomorrow. The governor and I are going to be there, and they have extra spots. And so they asked me to invite you. Go to colehealth.org website, and that'll tell you how to sign up. And you are allowed to come from Boone County or other counties as long as you're eligible. And so I hope many of your viewers will take advantage of that and get vaccinated tomorrow.
Dr. Williams, do you think the current rollout plan as it is, the way that the state handles its allocation from the federal government, is working in this tier so far?
Lucas, I really do. I look at other states, and I really like our plan. It got kind of touted nationally back in October when we rolled it out. I think the North Star, Lucas, has always been the most vulnerable. And as somebody who practiced for 30 years, at the bedside, you always want with government policy, why don't they know that these people are really, the most sick? And to the governor's credit, he's always said that I want to respect clinicians, and whatever population is most vulnerable, that's who I want to get vaccines. So I'm just greatly appreciative that he listened from a clinical perspective. And so on basis of that, I think we've been very true to that mission, and I'm very gratified for that.
So, Dr. Williams, along with what's happening in Jefferson City, tomorrow we're going to see some mass vaccination clinics in places like Kansas City and St. Louis, and really some state landmarks like Arrowhead Stadium, Forest Park coming up as well. I do also want to bring up, though, what we saw in the weeks prior with clinics in some rural areas that had hundreds or maybe even 1,000 unused doses that needed to go elsewhere or needed to be considered waste for whatever reason. In those early parts of the distribution, do you regret maybe sending too many doses to areas that didn't actually have the demand for the number delivered, whereas we're seeing, now these doses going into the bigger cities where demand apparently is much higher there?
No, not at all. Again, as I always explain to people, Lucas, there's always a trade-off between access and equity. And so, for the last 5 years, I've dealt with every day that delivering health care, and Margie would probably say the same thing for schools, is more challenging in your rural areas where people have to get on buses and go further, and we have to transport people in to get health care. But we've been committed from day one that by population, geographically, by most vulnerable communities, that we really wanted to prioritize equity. And at the end of the day, that's almost never going to be as efficient in certain areas as it is in, for instance, urban areas. And we see that in every state in the country, that there's always a trade-off between access and kind of quote-unquote efficiency and equity.
And Commissioner Van Dieven, this question is for you in regards to vaccinating teachers. Are there any specific plans focusing on teacher vaccinations, whether it be in some of the rural counties or in some of the bigger cities?
Yeah, I think that's been the exciting thing to see is the way that our communities have come together to support our teachers. We're seeing it done in very different ways. I was in Kansas City on Monday at the vaccination event that was hosted by Truman Medical Center for the Kansas City Public Schools. I too will be joining out at the Cole County event tomorrow because I believe a lot of our Jefferson City teachers will be there. If you follow our social media, we're trying to spotlight any place that we're seeing where these vaccination events are occurring. But it looks really different, as Dr. Williams just pointed out, in our rural areas and in our suburban and urban areas where they have access to those bigger hospitals and so forth. Our local health communities have worked very closely with our schools. And, I think one of the, we talk about the rollout of the plan. We knew the call would come, but nobody knew exactly sure when.
Sure.
And so we've had meeting after meeting. Dr. Williams and I have been together on webinars with both schools leaders and with local health officials to say, plan it, get it ready, and when the call comes, be ready to launch. And I think they've done a great job. Dr. Williams might want to comment on that as well, but I think they've done just a great job making sure that can happen.
And we can, we'll certainly continue that conversation, appreciate that, and a look at weather later on in the show.
Welcome back. If you're just now joining us, we are continuing our conversation tonight on Missouri's vaccination rollout progression and some relaxed health restrictions that we're seeing as a result.
We'll continue our discussion from earlier on this. I want to start with Commissioner Van Dieven here. This was something that came up last week, and I know a lot of parents across the state are wondering. Graduation coming up later this year. What's your conversations been like for school districts? What's your advice to them on whether or not to hold an in-person graduation ceremony?
Yeah, it's a really big conversation right now. I know we spend so much time talking about that class of 2020, and one of the things that parents are reminding us is that the class of 2021 missed a number of milestones, and we can't forget them and how the importance of graduation this year. So safety precautions, making sure we're recognizing each of those graduates. They sure deserve it, and we would hate to see that graduation go by the wayside, but it needs to be done safely.
And Dr. Randall Williams, I'd like for you to respond to that. What is the guidance that you're giving school districts and the conversation that you've had with Commissioner Van Dieven about these in-person graduation ceremonies?
Yeah, Deborah, I think it's just situational awareness that you're still going to need to continue to use hand washing. You're still going to try to social distance best you can. Being outside as opposed to inside probably makes some difference. Getting vaccinated, all those who can get vaccinated, faculty and staff. So I think just as she was saying, I think you need to take into account all those measures, which is, as Margie said, helps you to do it as safely as possible. But certainly very, sensitive and understand just how important. The governor has said from day one, it was really, as Margie said, got kind of Missouri in the top 5 in the country, the importance of in-person school, and that includes lots of things that occur in person. So certainly would hope that people would do all they could safely to make that happen.
And to that point, Dr. Williams, I do want to stay with you, as the CDC just earlier this week got on board with allowing 3-foot social distancing within schools. Obviously, 6 has been a number that we've heard for about a year now. Do you agree with that guidance for schools, okay for them to have a 3-foot social distancing?
Yeah, Lucas, actually they haven't formally come out and said that. Rochelle said that they're looking at that. There was a paper that they were commenting on that showed that that seemed to be effective. So we would be awaiting the official CDC guidance on that once they've reflected on that. So, I would think by the time graduation gets here, that will be forthcoming, but it's not there quite yet.
And Dr. Williams, we're starting to see, a lot more people obviously get really excited and trying to return back to the quote normal that we're all used to. And we're starting to see a little more events pop up. Obviously, summer's right around the corner and spring is here. Nice weather is going to come around. We're starting to see more people, have these types of events. And there's one actually, going on in Jefferson City tonight when it comes to the restaurant industry. What are your thoughts on these types of events that are starting to pop up? In some areas of the state, they may not have a mask mandate or any sort of social distancing or capacity limitation.
Yeah, I think at this moment in time, I think you still have to be aware. Again, Dr. Walensky says she thinks the dominant variant in the United States will be the UK by 2 more weeks. We know that's more infectious. We know that it causes more morbidity and actually more death. So I just think at this moment in time, as we're getting more people vaccinated, it's still really important, whether you're in school or graduation or any event, to really take those measures to heart. Now, I'm hoping that very quickly, hopefully by June, that we'll be in a different place as we get most Missourians who want a vaccine will have had one, but we're not there as of today. Sure. So it would just be very, again, purposeful in my advice to continue to do those things which keep you safe. Sure.
Dr. Randall Williams, Commissioner Margie Van Dieven, thank you both for joining us tonight.
We really appreciate your time tonight. And make sure you join us tonight coming up on ABC 17 News at 9 and 10 as we'll continue our discussion about the next vaccination phase that Missouri is about to go into.